Grab a life vest and climb aboard as we let the wind and the river take us on a journey to learn all about the relationship between airflow, resistance, and pressures in the respiratory system. If any of this sounds familiar, it's because these relationships are directly analogous to those in the cardiovascular system. In this case, airflow is analogous to blood flow, gas pressures to fluid pressures, and airway resistance to resistance of the blood vessels. Because of this, Ohms Law applies just as well to airflow as it does to blood flow. This is why the Delta Princess is back, and using its Q-shaped paddle wheel to stay safely upstream above the R-shaped dam. Ohms Law shows us that airflow is directly proportional to the pressure gradient between the mouth or nose and the alveoli. It's this pressure gradient that drives airflow. Ohms Law also tells us that airflow is inversely proportional to the resistance of the airways, which itself is subject to a variety of factors that we'll review right here in this sketch. The different factors that influence airflow resistance are described by Poiseuille's law. As you can see from the equation, there are a lot of letters, numbers, and symbols to remember. So, to make this important equation more fun, we're going to remix it sketchy style by recreating it using symbols that resemble each component. The first thing that Poiseuille tells us is that airway resistance is directly proportional to air viscosity. The more viscous the air, the more airway resistance. Generally speaking, viscosity refers to the thickness of a liquid or gas, which is why it's depicted here by this thick, dripping tree sap in the shape of a Greek letter eta. For the most part, air viscosity doesn't change, but we'll touch on a few special cases a little bit later. Second thing that this equation tells us is that airway resistance is also directly proportional to the length of the airway, meaning the longer the airway, the greater the airway resistance. This L-shaped tree should remind you of this, as well as why it's a pretty bad idea to try and breathe underwater through a really long straw. The last and most significant factor affecting airway resistance is airway radius, which is inversely proportional, but raised to the fourth power. This is why beneath our viscous sap-leaking tree, you'll see the inverted reflection of a half or radius split log and a raised 4-shaped hook. To help put this relationship into context, an airway radius that's halved or decreased by a factor of 2 will lead to airway resistance increasing and airflow decreasing by a factor of 16. And that's just when it's halved. If the radius were reduced by a factor of 4, airway resistance would increase and airflow would decrease by a factor of 256. This is precisely why the airway constriction associated with asthma can become so dangerous so quickly.